It depends on the severity of the trauma. It depends on someone's perception. So for example, let's say one witnesses a car accident and there's a fatality in that car accident or somebody dies. There could be people viewing that car accident that could develop trauma symptoms because they saw the accident occur. And there could be people inside the vehicle who they don't develop PTSD. And so that's one example. Most of the cases that I treat where somebody has PTSD, it is because there has been a death, a loss, and not something normative, usually something that's out of the ordinary. Somebody has been killed, they've been killed very violently or in an accident. I will also see folks who have PTSD who have been sexual assault victims. And so they've been offended and can recreate the trauma in their mind in that way. So those are pretty common forms.
Mm-hmm. Okay, Jimmy, can you ask the last two questions?
Oh, yeah. Bailey has experienced many traumatic experiences as a child. Would you consider her traumatized? What would you do to help?
It's a great question. So the technical term that we call it in psychology is vicarious trauma. And even for psychologists, what that means is somebody who is exposed to the stories of trauma or to someone else who has experienced trauma, we refer to it as vicarious trauma. So it's exposure not directly, but indirectly. And that over time can create problems in an individual who's exposed to it. We just don't call it PTSD, we call it vicarious trauma.
Mm-hmm. How can you relate to Haley?
Oh, well, I don't know if you guys know this, but the session just before this, they asked me to speak as well. Because I'm a military brat, and my father did 2 tours in Nam, and so in a lot of ways, it's my understanding I'm very similar to the character that Haley is in your book.
In our book, we see a man with PTSD, but never a woman. Are the symptoms of men and women different in PTSD?
No, the situations are very similar. Even for example, and this is going to be kind of graphic, I hope that's okay. So let's say I have 2 sexual assault victims and one is male and one is female, and they have symptoms of trauma or PTSD. Those will be very similar in terms of their reactions or responses. It's not gender specific. Yeah. The only thing that I might say that would be gender specific is because from a socialization standpoint, girls and women are more encouraged to talk about what they think and their feelings and express those things, whereas guys or men are not. That would impact in terms of their resilience to things or being able to be treated for things, but not the actual experience or response or the trauma itself, I don't think.
Nobody is able to really effectively help Andy overcome his PTSD in the book. What skills do you have to be able to effectively help somebody with PTSD?
Well, psychologists and mental health providers who treat people with PTSD really have to understand trauma. It's something that they either have to have a vast knowledge of or exposure to themselves. That's what really makes them good at their jobs. And so specifically to answer that question, when somebody develops the symptoms of PTSD, it usually happens about a month after they've been exposed to a trauma. And so before that, we call it an acute stress disorder. If it's after a month after a trauma has occurred, then it develops into PTSD. And as a result of that, if we get somebody into treatment very quickly after the trauma has occurred, so for example, the kiddos that I have that the homicide occurred in their family, I got them within 24 hours of the homicide occurring. It made it much easier for me to address the symptoms and help them heal in a shorter period of time than if somebody would have waited to come in. And so what happens is, like for example with war vets, if they come back from Afghanistan or wherever it is that they're stationed, and they have symptoms of PTSD, if somebody catches that within the first 6 months, it's much easier to treat and to manage those symptoms. If they've gone a long period of time without treatment, for example, I had an adult female who had PTSD, and the first time she came in for treatment was 4 years after the accident and the death occurred. That's very, very difficult to completely get rid of the symptoms. Usually what happens is you just have to teach them to manage it because it doesn't ever permanently go away. Now, I've heard some research studies about some things that they're doing with more neurological kinds of bases, where they say that they can treat PTSD symptoms long term. And so I think they spend a lot of time doing research trying to find permanent responses, because folks who struggle with PTSD do it over long periods of time and sometimes forever. So.
Another quick question. You said that sometimes it can take like a month for like the symptoms kind of like kick in.
Mm-hmm.
Is that kind of like when you if you break a bone, at first your like adrenaline takes over and it doesn't hurt as much, but then afterwards it starts to hurt? Is that kind of like what it is?
It's a really great analogy. And so what happens is that usually people are in shock. If there's been a death that's occurred, it usually takes them a while to digest the information, if you will. And so it could be that they develop those symptoms sooner, but like I said, we would then diagnose it as acute stress disorder, which means they're having trauma symptoms, but it's been less than 4 weeks. And if they persist, then it develops PTSD. But everybody's different. So somebody can have those symptoms and they don't show up for a while, because here's the great thing about the mind. A lot of times folks will be in denial or push things away or try, and it's your brain's way of trying to protect itself. And so it will try to push the thoughts aside or pretend as if something didn't happen to try to deal with it and to function. Well, pretty soon you can't ignore it. And so a lot of times that will also be a factor.
Yeah, that reoccurs with Andy and Haley a lot. Because, like, Haley, she tries to push away her past. Like, she forgot about almost, like, half the things that happened in her childhood. Because she doesn't want to remember them, because her childhood was, like, so traumatic and so, like, heartbreaking. So, like, she can barely remember, like, sort of, like, some of the things that she did with her grandma and with her stepmom that left. And with Andy, he lashes out sometimes, and then the next day he'll try to apologize to Haley once he lashes out on her. Like, he threw her phone into a fire pit one time, so the next day he tried to act like it never happened and he bought her a new phone. So yeah, we see that a lot in her book, and it's like, it's really sad.
It is really sad. And most of the times, folks who have PTSD are really embarrassed by their behavior. They're aware that they're really angry or that they respond in ways that other people don't. It's clear to them. It's usually why they withdraw and isolate, because they know that they're responding differently and it's not very comfortable to them.
Okay, so, Jimmy, first question is?
Yeah. What would you do to help Andy and Haley in our book? What advice would you give them?
Well, the very best treatment for a family or for a set of individuals would be to put them in group settings with other people who have had similar experiences, because it's more likely for them to speak again if there's other people around who they think understand or notice. In that particular situation, family therapy would be appropriate, to have everybody in the household in therapy together with one therapist. And so those would be a couple of different ways. In the military, they've got military folks who come in who are mental health providers who will address just PTSD symptoms with war vets. And so what really needs to happen is that happens more and more frequently than it does. That would help alleviate a lot of this, actually.
Okay. Ethan?
She kind of really already answered my question.
Yeah,
What was your question,
It was,
out of curiosity?
Have you ever seen and worked with men like Andy before in our book?
Yes, and lived with them. So, my father was not only like that, but I watched people that he used to hang around, his friends, also do those kinds of things. And I have seen war vets and recent war vets who have very difficult time functioning. The one that comes to mind is this very, very physically strong young man that came in, and he was in his early 20s. And so, boy, if you needed somebody to protect you, he'd be exactly the fella. But as strong as he was physically, he was not strong emotionally because he had PTSD. And so he would have a very difficult time in social situations and crowds. And what brought him in for treatment was actually that he was having a hard time in his marriage because his wife could not handle the symptoms he was experiencing. They'd be out at a ball game or they'd be doing something social, and he would lose his temper and he would become angry and frustrated, and they would have to leave a situation so he didn't fight with somebody or so he didn't act out and they caused a scene. And so his wife ultimately gave him an ultimatum and said, if you don't seek treatment, we can't stay together. And so a lot of times what you will see is if they have interpersonal relationships, girlfriends, wives, families, the family members will encourage them to get help because the symptoms affect everybody in the household. And it's very difficult to live with somebody who quickly angers, becomes frustrated, doesn't sleep well, you know, those kinds of things.
Yeah, so like in her book, Haley, she reacts about like her dad with PTSD by like ignoring schoolwork, trying to push that away. She pushes away her memories, sometimes her friends, and even her boyfriend. So like, you said you work with children and teenagers. Is this also common for their symptoms?
Yes, absolutely. And so I will watch them withdraw and isolate. So where they might be doing something normal, like somebody might have a sleepover, for instance, it was just Halloween, so they'd go in groups to trick or treat. Folks, especially little ones who have PTSD, they don't necessarily like to do those activities, so you won't see them doing things that their peers might be doing. They tend to be by themselves. When they do have friendships, it usually tends to be one or two select people that they trust or talk to. And they withdraw. They become what we refer to psychologically as flat. So they look like they have no emotional response because they try to distance themselves from things. And so those are things that are common. So for instance, one of the young ladies that I was speaking to yesterday, these were her sentences or words. She would say, I can't even cry. I want to cry, but I can't. And so that's very typical.
Okay. So like, this isn't a question, but the sad thing about this book is that, so Haley traveled around with her dad, like, at a very young age until she was about like 16, senior in high school, in the truck. So like, I know it's good that they had that bonding time, but the sad thing is that he isolated himself from the world, but he had to isolate her too, because they didn't know what to do with her. So she never really had that chance to get social with anyone. She was just taken away from it by her dad.
You're making a really great point. And again, given that I had that experience personally, we would move on average every 2 years. And so you would have to make friends all over again. You'd have to get to know new environments or figure out your way around. And there can be some great things that happen from that. Like I'm pretty versatile and can accommodate no matter where I'm at or what I'm doing. But it also means that it's pretty hard to connect with people because you know you're not going to be there very long.
Yeah.
And so it takes a special skill set to do that.
Okay.
It also makes school pretty hard because if you move from one school to the next every couple of years, not all schools do things the same.
Yeah.
So sometimes you might repeat work you've already done, or sometimes you'll be exposed to work that you hadn't seen before, so it makes it really difficult academically. That might be another reason why she maybe distanced herself and kind of let the schoolwork go.
Yeah, and the other reason is she was homeschooled with her dad. She never went to school since like kindergarten, and then she came back
Wow.
in senior year, high school.
She's,
It was
in the book,
extremely
she's going on
difficult.
18. I don't know if she was at the end.
Yeah.
Wow. Holy cow.
Yeah, was really difficult.